welcome to another great edition of the Coston Show. Thank you so much for joining us. My name is Bethany Criswell.
And I'm Roland J. Coston Criswell.
I first want to say thank you so much to all our viewers for sending us email messages as well as Facebook messages on our Facebook page. We've been getting some great topic ideas for our shows as well as some great questions that we can ask our guests in the future.
This week, our guest is Andrea Kimple from Pittsburgh Healthy Start.
She will be joining us right after we hear from Roland Criswell with this week's pre-need presentation. So we're going to take a quick break, and when we come back, we will hear from Roland Criswell with our pre-need presentation for the week.
To be a doctor. I have a promise to be a chef.
Did you know that what children learn before kindergarten affects how well they will do in school and even what they might be when they grow up? Reading to children at home and choosing quality early learning programs are great ways to help children build the skills they will need for life. For more ideas, visit papromiseforchildren.com.
Because every child is Pennsylvania's future.
Hello, Greater Pittsburgh. Today's pre-need segment is going to focus on methods of payment for funeral expenses. The first method of payment I want to share with you is the most popular method of payment that people use, and that is dealing with insurance policies. Oftentimes, people will bring their insurance policy to the funeral home, and they will use that insurance policy to cover the funeral expenses. How do they do that? Well, we identify the beneficiary of the insurance policy, and that beneficiary will sign an assignment. Now, it's best to have the insurance policy, but if you don't have the insurance policy, then you should have at least the policy number and the name of the company. How do you know the name of the company? Hopefully, the person who has passed away has shared that information with you. So once we have identified the beneficiary signs what's called an assignment. Now, a very key component of this is knowing who the beneficiary is and being able to identify that. Unfortunately, I see a lot of times when you have a husband and a wife, the husband or the wife may be the beneficiary, but what if that husband or wife has already passed away before the other spouse has passed away? So you have a gentleman named John Doe who died years ago, and now his wife Jane has passed away. But John was listed as the beneficiary on Jane's policy. Well, who's the beneficiary now? That could be a problem. So a word to the wise is every 2 years you should update the beneficiary on your policy and ask the insurance company to send you a document stating that they received that update. Also, there's something called a contingent beneficiary. The contingent beneficiary is a fancy word that insurance company use for the backup beneficiary. So John may be the primary beneficiary, and the contingent beneficiary may be one of your children. Let these individuals know that they are the beneficiaries on your policy. A second thing I want to share with you about insurance policies is the contestable period of an insurance policy. Contestable sounds exactly what the word means, contest. An insurance policy has to be active for at least 2 years for the insurance company to honor and pay the full face amount of that insurance policy. If the insurance policy is inactive for 2 years, the insurance company will research in their records if there's any reason why they don't have to pay the full face amount of that insurance policy. So make sure that if you have insurance policies, if you're going to get new insurance policies, that you want to have a policy that's outside of the 2-year period so the funeral home can use that. Another way that people pay for the funeral expenses are prepayment options. As funeral directors, if someone were to come to a funeral home and prepay their funeral expenses, funeral directors are required by the state of Pennsylvania to put 100% of those funds within a trust. So as a client of a funeral home, you should ask the funeral director for the information to where that money has been placed. If anything ever happened to that funeral home or you just did not want to use that funeral home, any funeral home even if it's not the funeral home you open up the trust with, can access that money with a death certificate. This is some helpful information on how you pay for funeral expenses. So first, it was an insurance policy. The second is if you pre-need an insurance funeral expenses, and if you do pre-need, you can also set that up on a payment plan where you're paying so much money a month until the entire funeral expenses are paid for. Lastly is the traditional methods of cash, check, or credit card. So these are some ways that you can prepay for your funeral expenses. I hope this information was helpful to you. Next week, we're going to be discussing different cemetery options and some popular cemeteries in the Pittsburgh area. Join us after this break.
Can I go to the sleepover?
Lucy, I want you to promise me something. If there's any drinking, I want you to say, "No thanks, not my thing."
Mom.
I promise you, your real friends won't care. Deal?
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov. A public service message from the Substance Abuse and Mental Health Services Administration.
We've got a big problem, and we need your help.
It's called sexual assault, and it has to stop.
We have to stop it. So listen up.
If she doesn't consent, or if she can't consent,
it's a crime. It's wrong.
We need all of you to be part of the solution. This is about respect. It's about responsibility.
It's up to all of us to put an end to sexual assault. And that starts with you.
Because one is too many.
Welcome back to the Coston Show. Thanks again for joining us. Today we have a special guest. We have Miss Andrea Kimple from Healthy Start. Welcome to the show, Andrea.
Thank you for having me.
No problem. So, can you give us an idea and tell us about yourself and what you do at Healthy Start?
Sure. Healthy Start is a health and human service agency. We are federally funded. We have been in business since 1991, and our mission is to reduce infant mortality and low birth weight babies in southwestern Pennsylvania. Myself, I've been at Healthy Start. I'm going into my 8th year. I am the Director of Human Resources and Training, and in September of 2013, I was named the Acting Executive Director when our ED had passed.
Okay.
So I've been doing both roles since then.
Okay.
Can you tell us some of the programs that Healthy Start offers?
Sure. Healthy Start is a free service to anyone who lives in Allegheny County. And we work with men and women who are parenting, pregnant, or have children under the age of 2. As I said, we're a home visiting agency, so our workers come to you. We employ a multidisciplinary team, and our team is made up of community health workers, nurses, social workers, who go into the homes and mentor and train, educate women and men on how they really can stay healthy and safe, and their babies as well, so that they can have positive birth outcomes.
Now, I know you mentioned you do both help for women and men. So do you often get any men who are looking to get this type of service for their child?
Absolutely. We
Okay.
Currently case manage, I believe it's around 68 men.
Okay.
Our fathers can be involved in our program when their significant other wife is enrolled in the women's program.
Okay.
In the past, I've heard of a cribs for kids type of program. Is Healthy Start involved with that, or was that your initiative?
No.
Because I know a lot of infant deaths do occur in the cribs. What kind of training does Healthy Start give as far as how to properly put their child to bed?
We do SIDS training in-home and then with our staff as well. Okay. We have experts that come in and really teach all of those things, how you should put your baby down, promoting safe sleep patterns, and then as well as educating, and we put out education. We'll have information tables at our building, in our office.
So now, do you do training from when the infant is in the mother's womb, or is it once the child is born?
No. We do
2? Okay.
0 to 2.
Okay.
So
Okay.
from the beginning till 2 years old.
Okay. So, and do you all do anything with like training on breastfeeding or?
We do.
Okay.
We always encourage our moms to breastfeed. Obviously, some can't. But we always encourage that, and our community health workers and our nurses will assist them and give them the resources that they need. We also have a helpline that during the day we have lactation consultants that work for the county that moms can call.
Okay.
It's unfortunate that we do see infant deaths at our funeral home and in the funeral profession. Can you speak to the connection between environmental smoking or smoking that may occur within the home and infant deaths? How is that related?
Smoking relating to death of an
Yeah, because
infant.
I think that a lot of sometimes my clients, I don't think that they know how unhealthy smoking around children may be, and unfortunately sometimes when we do bury infants, I do see a pattern of smoking within the household. So I just wanted you to speak to that, to kind of educate our viewing audience about the unhealthy connection between smoking in a household and infant death.
Well, smoking, and it has been proven, is directly related to SIDS cases. Whether, even if you step outside of your home to smoke, it's still on you. And the infant can definitely, and you go in and you pick up your baby, it's still considered secondhand smoke. So it is, it's dangerous.
I'm glad you said that because we have 2 young children, and I remember when our children were born, we saw that study that came out that said the carcinogens from smoking is still on you. So when people were handling our child, we were very cognizant of if they were smoking or not. And I know people looked at us like we were crazy, but that's something that we were concerned about.
Absolutely, absolutely.
So I know you mentioned about how you have services for people who you come out to their home and you have different professionals that'll work with people in the home. Can you touch a little bit more on that?
Sure. We have our community health workers that mom will call into our program. We get them enrolled. We send out someone to go to their home and explain the services, set them up with an outreach worker. We visit them probably once a month, and we do, the in-home training. We'll first evaluate, make sure that there's a safe spot for the baby. If they need food, make the appropriate referrals. And then, of course, we have our nursing services. So if it's a high-risk pregnancy, our nurse can go out and just make sure that mom is keeping up with her visits to the doctor, that her weight stays consistent, that she's not gaining too much weight or losing weight, healthy eating choices. So it's really centered around education.
Okay. Well, we are going to have more with Andrea when we come right back. We'll take a quick break and we'll have more with Andrea. Welcome back to the Coston Show. Once again, I have with us today, joining us, Andrea Kimple from Healthy Start. Welcome again.
Thank you.
So last segment we were talking about some of the programs that you all offer. Did you want to mention a few specific programs or initiatives that you all offer?
Sure. Right now we are doing our art therapy for some moms that are involved in our program. It's an 8-week course, and it's really centered on the art, the painting, taking pictures. We provide childcare for them while they're there, and it's also a good support system for them where the moms can come and get together and just talk. So we started that yesterday. This is the second time we're doing our art therapy. We also do life skills classes, and those classes include job readiness, banking, how to do your laundry, healthy eating, cooking. We also have infant massage that our workers are trained to do and can go into the homes and do that and show mom and dad on how to do an infant massage. We are going to be starting, I believe it's in January, Zumba classes as well. And those will be open to any participant, whether it's a male or female, mom or dad, as well as my staff.
Okay, that's a great idea, because we all know that exercising is key in maintaining your weight as well as leading a healthier lifestyle. But I wanted to ask you about, you said that it creates like the art classes for therapy, but I was also going to touch on the point that when you socialize with other mothers, you get to create a community amongst one another.
That's
correct.
correct.
So sometimes you may need a babysitter. Hey, can you pick up my child from the bus stop? It just really helps with everybody working together in times in which they may not have someone to watch their child or to pick them up from the babysitter. But because they are getting to know one another as moms, they get to socialize with one another. So can you just touch on that, the social aspect for creating a community amongst the moms?
And it is, because you know, some of these young ladies, they don't have a support system. We become their support system. And when we do programs like this, they see, you know, other mothers that are there. And like I said, we, you know, have childcare available. So, you know, the babies are there. And it's just a really good, where they can use each other as sounding boards and just really nice, strong support system for them.
Right.
It sounds like that you all are really an outlet for a lot of people. As parents, we with young children, we value the outlets. I also love to hear that you all do a lot of life skills as parents as well. We learn that there's no handbook that comes with the children. So that being said, if there's people in our audience who want to get enrolled or get connected to Healthy Start, how do they begin that process?
Well, we get a lot of our referrals from word of mouth in the community, for sure. We have a 6-region consortium that lives and works in their own communities, and they meet, I think it's once every 2 months where they meet, and they really come to us, and they're community members that come to us and say, this is what my community needs. So there are our eyes and ears of the communities directly. We also, you know, we have a website, so it's www.healthystartpittsburgh.com. That you can visit and you can enroll right on the website. Word of mouth, as I said, right now our outreach workers, our community health workers are doing canvassing. They're in the Hill District this week. So if anyone sees door knockers on their door, please call the number. We can assist you.
Okay.
And we try to be as visible as we can in the community.
Also, can you give us the phone number to Healthy Start?
The phone number is 412-247-1000.
And then you also mentioned the different areas that you have the consortium. And can you talk about the different areas that you're located here in Pittsburgh?
We actually serve anyone in Allegheny County. So we're throughout the whole county.
Okay.
Yes.
Can you repeat your website once again?
www.healthystartpittsburgh.com.
So what's next up for Healthy Start? I know you all have a calendar of events, so can you just share with our audience a couple of events that you have coming up next?
Okay. January, we're starting Zumba, as I had mentioned. We always participate in the Highmark Walk for a Healthy Community. We are also going to be putting on, I believe it is our 12th annual Cultural Sensitivity Symposium that is open to anyone in Allegheny, any health and human service provider in Allegheny County. This year, the topic is healthy living, so we are going to address all of, well, as much as we can in a day. So, and then we have our volunteer recognition at the end of May. So it's kind of what we have going on for right now.
Well, I'd like to thank you so much, Andrea, for joining us today.
Thank you for having
me. We truly
me.
appreciate it, and I hope that our audience has learned some valuable information because Healthy Start does some great activities and programs throughout the city. So thank you. After this quick break, we'll be right back.
I've seen too many women with breast cancer who could have avoided extensive treatment or even death had they gotten an annual mammogram. I know this is my mammogram and this is my breast cancer. I was 46. Now I'm enjoying the life I might have missed because I took charge of my health. If you're 40 or older, get a mammogram every year. If you have a family history or other risk factors, talk to your doctor about what's right for you. To find an accredited center, visit mammography-saves-lives.org.
Thank you so much for joining us this week. I hope you enjoyed our guest, Andrea from Healthy Start. She shared some great information, and I hope that you were able to take some information back with you.
Please join us next week as we visit Pittsburgh's Caring Place in downtown Pittsburgh. You don't want to miss that show.
Thank you.